Um, so we're gonna do like a joint session, and because this is the very first talk of the week, I wanted to kind of like make it really open and leave time at the end for us to have a conversation. That's what I would love to have as we're in person again, and Zoom conversations just aren't the same. So, I mean, all of you absolutely please join in. And should I keep an eye on the chat, or one of you looking at the chat? Okay, I'm going to ignore the chat then. And so I just wanted to kind of talk about my experience. I don't know how many of you, I apologize for having to ask this, but how many of you were here last year?
None.
None. Okay, great. So I'll introduce myself and give a little bit of background about my experiences in global health, which have all been in Peru. And then Angela and I have worked together, and she's going to talk a little bit about COVID in Peru, which like kind of continues to dominate the conversation down there, although it's much better. And I think then hopefully we'll leave plenty of time for us to kind of have a more general conversation about working in global health, the ways that we can be involved, and answer any other questions you guys might have. Does that sound good? Okay, great. So I have been working in Peru. My first trip down there was in 2005, and I went down to teach medical English to Peruvian rescue workers in the high Andes, because English is the international language of mountain rescue, because all over the world, people speak different languages, but English is a common denominator in terms of most likely second language for people. So that's an interesting little tidbit. So I went down there to teach medical English, and met my current husband my third day in Peru. And we hit it off right away. And we've been together ever since. And that kind of that was after my first year of med school. And I was like interested in global health and like wanted to go do this. And my best friend from med school is Peruvian American. And so she was like, go there for the summer, you'll work on your Spanish. And because I was not, you know, as fluent as I am now by a long stretch. So anyway, long story short, we have been married for, I don't know, like a while, like 15 years or something. I haven't done the math recently, but anyway, and we have 4 kids. And up until COVID hit, we were living in Peru full time, and I would commute back to the United States every month to do my clinical work at the General. And we have like a humongous family in Peru. So that worked great because we built an apartment building for my family, our family, and all my in-laws to live in, which is still there. And so anyway, COVID was the one thing that could totally blow up our life. And it did. And I was separated. At that point, we only had 3 kids, and I was separated from my husband and kids for 3.5 months that spring with COVID, because I flew up March 16th to do a 10-day stint and ended up living in a hotel in Union Square for 3 months while we tried to evacuate them because the borders were closed, and we had to get the State Department to help like bring them up on special flights. And that's not easy to do, actually. So Peru has these laws about minors, and they can't leave the country unless both parents are physically present or have signed a notarized letter. You can't get notarized letters because the consulate in Peru, where you could actually get the Peruvian notary to sign it, were closed because of COVID. So it took almost 4 months in the State Department. In the meantime, I had been breastfeeding my 1.5-year-old. I finally gave up pumping after like a month because I was like, this is not sustainable. Like, it was the most traumatic thing I've ever experienced in my life. And not every, there's a lot of traumatic things that can happen in life. And so I have to consider myself lucky because that was the most traumatic. But man, was it traumatic. Like, it was brutal. And I think ever since then, it's like, kind of like in public health all over the world, it's like COVID just kind of like broke everything. And I feel like that personally. And I feel like that also happened in Peru. And unfortunately in Peru, it has the like very unhappy distinction of having the highest per capita mortality rate of any country in the world. And it's actually held even after all the adjusted death rates have come out. And like, I mean, Angela and I, we talked about it again this morning. It's like what? Like Peru, like it just doesn't feel like it should be. Like there should be, you know, I mean, it was this sort of, I don't know, it doesn't completely make sense to me, because it was like it had become a high middle income country. And, you know, for all the other, and I think it was just that it was like at the forefront of these waves of contact from, you know, European and American tourists, not even knowing they brought it. And then it just went out into the like areas of Peru, which are not high middle income, and really devastated communities, but also devastated. Like I live in Arequipa. I lived in Arequipa, and that's where Angela is, and it's the second largest city in Peru. And it's got like 1 million people. It has, you know, ICUs, not that many beds. Like there were definitely insufficient ICU beds for the surges that happened. But people, I think, avoided going to the hospital because they knew that there wasn't anything for them there. And, you know, I know my family members avoided going to the hospital when they got COVID, even like back in August of 2020, because they were so overfilled, it couldn't really, there was nervousness about getting stuck in a hallway somewhere and not getting treated, and whether that was a reality or just fear. You know, I think it was probably a combination of both, but there were, luckily, none of my immediate family members died from COVID during that. But in terms of our like community, the people around, it was like devastating. Like all of the sort of people who, you know, lives I touched and they touched my life, they died. And so we finally just went back for the first time in August. We're still in August, we're almost out of August. Anyway, like a couple weeks ago, I went back to Peru for the first time with the family. And it was so good to be back. Our apartment was like, it was like a mausoleum to our former life. Like nothing had been touched for 2 years since my husband and the kids left. So, you know, like I have like a 13-year-old and a 10-year-old and a now 4-year-old and an 8-month-old. And so the older kids like had like growth spurts of 4 and 5 inches, and they were holding up all these tiny little clothes, and like we like just bagged everything, put it up for donation. I mean, it was crazy. Our life was just, we had to like clear the deck. It was wild. I found my espresso maker still had coffee in it because it had never gotten cleaned. And I was like, okay, I gotta like dump the coffee grounds out from 2.5 years ago, clean it. It was crazy. So I think, you know, like I feel like every year, it's the 3rd year that we've been doing this lecture during COVID times, and I'm like, all right, I'm gonna like, this year I'm gonna like get over my personal trauma and just give a really nice academic talk about like public health in global context and the like continuing colonization of the world, and how that's like created such inequality. And like, even when you think you're a middle income country and you've, you know, overcome and have like established really strong healthcare, turns out like pandemics can like uproot all of that. And like, never mind talking about pediatrics, like we were just talking about it this morning. It's like, oh my gosh, we have to like start now at the 2.5-year mark, figuring out like, how has the pandemic affected the children of Peru? We need to start those studies. Nothing is figured out yet. I guarantee vaccinations are behind, education is behind, all like regular child, you know, mental health, I don't know. And it's like, you have to start from here. And this year I am like, okay, I still really, I think it's because for me, like, I was thinking about this on the drive over and I was like, what is I cannot like get over this. And I was like, it's because it's like way more personal than professional for me. It's like 15% professional and 85% personal, which is like a hard thing if it's like supposed to be your job too. And then like, okay, it's not really. And I think if I can, I'll explain that to you guys and say like, this is who I am and what I have to offer and why I'm like passionate about it, because it's not about, my work, it's about my family and our life. And like, I have, my husband's from a big family. So we have, there's 13 grandchildren ranging in age from 21 years old to my 8-month-old is the littlest. And, that's like a whole big span of pediatric age ranges, and so many things come up. And like, I don't know if any of you have kids, but when you're thinking about being a pediatrician and thinking about the experience of other children and how it could be your child and how you want, the world and the systems to react to it, that's when it feels like, okay, this is like really important, And I think that like living down there with our family for the years that we did before COVID was like, all the personal experiences of being a parent and parenting in Peru and having my kids in the school systems there, getting their doctor checks there, all of that stuff. It was like, oh, like this could be a project and this could be a project and this could be a project. Just like here, it's the same thing, it's like, oh, like this is the experience taking your kids somewhere, like that could be improved or this could be improved. It's like a way to think about things with a system. And like, you create a little buffer when you do that too. And I think that the thing that's tricky is figuring out like operate without the buffer, but also be successful in like creating progress and moving forward. And I think we're finally reaching a point where I feel encouraged about the ability to travel internationally at this point in the pandemic, and the immense need there is to start getting the work done again as it pertains to pediatrics and global health. So I think like I feel really excited for you all, and I think that there's like so much potential, but we're starting from a really unique place. In all the years that I've been like doing this and thinking about it, this is not the way people were thinking about things 5 years ago. It feels very different. And so I think like in the world of global health, there'll be like the pre-pandemic mind frame and the post-pandemic mind. I just like everything in medicine, I think, but like in global health in particular. And I feel interested to see how that conversation goes, because I'm one person, and for me, everything just like exploded and the dust is still settling. And I think for other people, it's like you can kind of keep your eye on the prize and like keep working on specific things. And because when I did global health, I always did like everything in child health. Anybody under 18, if it was anything related to their health or wellness, I was like in for a project on it, because I'm very much a generalist at San Francisco General, and I kind of applied the same thing to any project that I would get involved in Peru. So it was more like, as long as it's in Arequipa and it has to do with somebody under 18, I can be involved in it. But I think that like, because no kids went to school anymore, and kids, even like clinics at the beginning of it, stopped seeing pediatric patients completely. Like, the schools just started doing in-person again in March. And I have to say, like, there's still a hyper focus on COVID. I was so surprised when you go down there. It's not like here, like the Peruvian airlines, as soon as you're on them, masks are mandatory on the airplane still, as opposed to here where it's optional. When you go into any institution there, you have to be masked with either a KF94 or N95 or a double surgical mask. You can't even just wear a single surgical mask and show proof of your vaccination when you enter like the mall or something like that. So it's actually their vaccine. I'm going to not get into all of that because I know Angela's going to touch on the vaccination and stuff too. But yeah, I think I'm excited to start having a conversation with you guys, but I want to give Angela some time to go through the slides that she's prepared. And she was there in person on the ground doing all of the work during COVID. So I applaud you, my friend, and I want to give you the floor now to talk about COVID in Peru and your experiences. I don't know if you want to share your screen so that everyone can see your slides, Angela.
Yeah, I can share it now.
Okay, great. I'm gonna sit down and watch. And then when you're done, I think we can open it up for questions and discussion to the group here and on Zoom.
Could you see the presentation?
Yes.
Yes.
Great. Okay. Thank you, Holly. Well, I'm Dr. Angela. What I'm going to touch now is the perspectives and the actual situation, the current situation of COVID in Peru. First of all, we have a health system that is organized by levels. The first level, it's 1-1, 1-2, 1-3, and 1-4. It means there are medical centers, health centers, where we see patients in ambulatory treatments and preventive measures. I'm sorry, my English. They are open usually 12 hours a day, but only the level 1-4 opens 24 hours a day and assists pregnant patients with labor. So it's every day, even Sundays or holidays, it's open. The second level are the hospitals, which receives the patients for specialist consults, like cardiology and endocrinology, surgery. They have operation rooms. They do what every hospital does. And the third level, it's the specialized care, like institutions, like institutes. They are more focusing researches and focusing some specific diseases like oncology or like children treatments in the country, but only in the main cities like Lima, Arequipa, and Trujillo have this level. This is a picture, the first level, the second, and the third. This is how we work there. When a patient has any symptoms, he usually goes to the medical center, to the health center. So we see if we can see the patient here, or we have to refer the patient to any hospitals. During the pandemic, we have this temporary isolation center that it was only for COVID. Because the hospitals were so saturated that they cannot have more patients. So they opened these temporary isolation centers so we could send patients there. Also in the altitude in the cities where there is so few health professionals, we have these community isolation centers. Since the beginning of the pandemic, every medical center of health centers had the two areas, the COVID and no COVID. The hospitals also had these two areas, but we know that in not COVID area, we can have patients that maybe we have a false negative test, but we know that they can have COVID. So all the measures of security, biosecurity, are taken in both areas in the same way. This is an example of COVID areas, as the medical centers or health centers were small. So what we did, we made these areas that are with the ventilation and the patient can be examined at least. We put it in the parking places of the health centers or like this in the schools. because during the pandemic until March this year, all the schools were closed. We only have virtual classes, so we could use the infrastructure the infrastructure of the schools to see patients during the pandemic. So it's what we did. This is an example of how saturated were the hospitals in my city, in Arequipa, like about 1 million people. We have two public hospitals, and one of them was denominated the COVID hospitals, that it was the general hospital, and the other one was not COVID, I mean for the other patients, they divided. So in the general hospital, this is what we saw during the pandemic, during the waves. People didn't have space in emergency, so they were in the parking places. They brought the tents, they brought the oxygen balloons to wait for the consul in emergency. This is one example of the temporary isolation centers of COVID, where we only have these oxygen concentrators and some oxygen balloons to see patients, at least to not be outside of the building. This is an example of the triage emergency in general hospital. It was so crowded. It was so many patients and so few professionals taking care of the patient. This was unusual situation every day we used to have during the pandemic. And this is the current information we have in the Sala Situacional, I mean, all the statistical that is renovated every week. This, I take it this yesterday, and it was until August 21. We have here that until that date, we have 215,342 patients who died. And we have in total a population in the country of more than 34 millions. And the total of cases positive were more than 4 millions, but the lethality was high. We were talking with Dr. Holly in the morning, and maybe it's also the culture. We were seeing the possibilities of causes. Like, for example, here it's very usual that the families live together in one house, or at least the houses are very close one to the other and are very small. So it's very difficult to have a real quarantine, real isolation of patients. If one person of the family got sick or got the COVID, it's for sure that all the family in that house are going to have it. Also the immunity, maybe our immunity is low. We have a high incidence of desnutrition and anemia in our population. So I think that's another possible cause. The researchers are still showing, and they are still running many researches about these causes, but until now they are not they didn't show yet big results about it. They are still analyzing the statistical. About the intensive care beds, that was another debility in our system. Before pandemic, we had less than 100 beds, intensive care beds in all the country. Nowadays, we have 750 in all the countries. And during the pandemic, most of them were occupied by patients. But until August 21, we have this in yellow color. This is the number of beds that are available, and in red, it's the number of beds that are occupied by patients. So we can see that we have around 75% that are available. It's because now we are after the fourth wave, and we have much less patients that we used to have. This is the COVID deaths until August 21. 215,242 patients died. If we can see here in children, it was 1,024. And according to the studies, we saw that these children, they died because they have another diseases, I mean, comorbidity, another problem like oncology, but not only COVID. So for that, we have this number. As we see, the older people were the more affected in death. Now we have the vaccination situation until now. This data is until yesterday. In the first doses, we have more than 90% covered. And in the second doses, more than 85%. And the third doses, more than 70%. And the fourth doses, we have more than 20%. We now here are people over 18 years old that are receiving this vaccine. And this vaccine is the Moderna vaccines that we are using for the fourth doses of vaccination. Here, for example, we have that every day we vaccine 2,917 people in the country per day. So that's what that's the way we are advancing with this vaccination. And for that also the mortality decreases very, very, very low after we started the vaccination in the population. This is also this chart. I take it so you can see that in the children from 5 to 11 years old, we have in red. I mean, in many cities, we are under 50%, 70%, sorry, of the population. So we are now pushing and trying to focus on this population to get the vaccine more than 80%. This is the situation in the country in the map. We see that in the jungle, it's this part is the jungle of the country. That's the area where we need to arrive more, to focus more, because also the way to enter the communities is very difficult. So in the coast, it's easier, but in the jungle it's more difficult. So we have to increase our effort to arrive well and to recover until more than 80%. We have here by regions, in these regions, more difficult the vaccination, less than 70%, the one that are in red. The mortality in doctors, the doctors, we suffer since April 2020 until now, 573 medicine doctors that died because of COVID. That it's the highest profession that were affected by COVID. The nurses were around 150 nurses are in all the country. But since we started the vaccinations in professional and health professionals in February 2021, it decreased a lot. After 2 months, it decreased a lot. Here, this is the data in Iberoamerica, since Mexico to Chile, and we are here. Peru, it's here. We see that in Mexico, there were more medicine doctors who died for COVID than Brazil, and then we are in Peru. This is some pictures of the intensive care units were in the National Institute for Children in Lima. This is a case of a patient, Daniela, that it was very known in the country. It has a lot of attention because it was a patient, a child patient of 9 years old. She entered intensive care and she recovered, but after that she was diagnosed with Guillain-Barré and she's still recovering of it. And the next infectious disease we have, it's monkeypox. Actually, until yesterday, in all the country, we have 1,282 patients. In Arequipa, the city where I live, we have 40 patients, but we have not mortality yet. We are trying to improve our biosecurity, but for sure it is not as bad as COVID. In my medical center where I work, we see patients 24 hours a day. We see the pregnant woman, and life continues during the pandemic. And this is a picture of one of our patients during the pandemic. This is the way we see, this is the way we still assist patients, but it's going well. The babies decrease. I mean, the mothers are some afraid to go to the health center, so they are trying to get the clinical, I mean, the private area. But if they have enough economy, they can do it. If not, they can come to our medical centers, and we are slowly increasing again the patients with labor, like in this picture. During the pandemic, we have to work together with the police and even the army. This is how the brigadas, we say, the groups, prepare to go and visit some difficult areas in the country to prevent and to patients of COVID. This is one other example of how we saw patients in a ventilated area, like this, in parks or in parking places. And this is my city. This is the center, the main church, and the Misty, the volcano we have. We're happy that we just finished some weeks ago the fourth wave in our country. And unfortunately, we have much less mortality. I mean, much less people dying. Usually who now are in intensive care or dying are people who are not vaccinated or with another diseases that decrease their immunity. Thank you. This is all what I have to share with you. If you have any question, maybe Holly.
Okay, thank you so much for sharing that, Angela. I think the pictures especially really speak volumes to the situation there. I know from like family members, getting oxygen was kind of the primary thing, and people were trying to source their own oxygen for home oxygen delivery very frequently. And even as you mentioned, people who have to deliver babies were trying as much as possible to do it outside of the system, the public system of hospitals, which would normally provide a hospital delivery experience, and trying to, whenever possible, if you can have the money and pay, to go to a private clinic where there wouldn't be the same number of COVID exposures. That's what you were getting at, right? That you can, if you can pay to deliver your baby somewhere else, you can avoid the hospital delivery. And I think that kind of, those details really speak to the split system that exists in Peru. That reminds me a lot of our split system of, if you have private insurance, or outside of California, it's like insurance versus no insurance, and then a public system, and there being really different different care being delivered in different layers of the system, in a lot of the parts of the country, both in Peru and here. Actually, I think there's a lot of similarities with the problems inherent in the healthcare system. Okay, so we have about 15 minutes left, and I thought, I don't know, we've talked about a lot of different things, but I wanted to open it up to see whether anybody either on the Zoom or here in person has questions, comments, points of clarification while we still have some time to chat. Yeah.
I have a really basic question. I know that they talked about, or both of you talked a lot about the discrepancy in mortality rate relative to other countries or whatever comparable countries. Does that discrepancy also hold for pediatric patients there?
From COVID specifically,
Yeah.
or pre-COVID?
Yeah, COVID in terms of a relatively higher mortality rate as opposed to other countries.
Yeah, sure. So the question was, does the discrepancy in the overall COVID mortality hold when you're looking at pediatric mortality data? And I know the pediatric Peru data better than I know the pediatric data for other countries. So I can't actually specifically, I don't know. Angela, do you know, have you done a comparison of Peruvian pediatric mortality compared to other countries' pediatric mortality?
I don't have the data, but for sure it is. It was the same incidence, because the patients we have with mortality for COVID in Peru, it was not because only for COVID. It was because of other diseases. I mean, they didn't do this respiratory insufficiency that we had in adults, but they have other diseases. And the more usual disease we saw, it was oncology. The patients, the pediatric patients with oncology that also have the COVID infection, they died. But we were some relieved that it was not because for COVID the main reason of the disease, of the death.
I will say, in terms of the number of ICU beds and the number of pediatric ICU beds, I mean, Peru had a really low number of ICU beds compared to the population, which I think when you have these huge surges and a general population where, pre-vaccination, it was the same problem. Healthy people were getting the early waves of COVID unvaccinated and getting intubated and, or needing intubation. And if the ICU beds aren't there, they died. And so I think a lot of that, the lack, I mean, there's almost no pediatric ICU beds in Peru. I don't know the number, but there's a handful of hospitals that have pediatric ICU. In the whole country. And so for those children who already had underlying illness, who could have gotten sicker with COVID, there's not a lot of recourse for them. So to me, 1,000 pediatric deaths for COVID in the country is a really high number. But similarly to the United States, compared to the effect on the adult population, it's a tiny percentage of the actual deaths. So it was not the big area of loss per se, but it seems out of proportion to me, similar to the adults.
Thanks. There's a question in the chat that's probably more so for Angela. It's asking if you have mortality rates for physicians by province.
Yeah, for that question in the chat, to be honest, I don't have the exact data, but for sure I can tell you that the main number of doctors or physicians who died, it is in Lima, but it's not because in proportion with the other provinces. It's because in Lima we have more than 9 million people. I mean, the density is so high, but we also have much more physicians there than in the other places. And in Arequipa and Trujillo are the two second cities in the country. So that's the second place and third place of physicians who died. But something that it was very sad, that is in the fourth place, we can have the jungle. In the jungle, the physicians died, but it was not because the immunity or comorbidity. The main problem there was the fault of oxygen. I can tell you that because I am in the group in the board of the medical college here in Arequipa. So we have the contact in the moment with all the boards in the medical college of the cities, including Lima. And during the pandemic, I could see how we were coordinating the doctors in the jungle. They get the COVID and they didn't have oxygen. So the medical college had to hire private airplanes, private planes to transport the doctors to Lima. Many of them could recover, but many of them couldn't, because even to get planes or airplanes during the pandemic was difficult and was so expensive. But it's very sad to say, but in the jungle, most of the physicians who died was because of that. So you can imagine if the physicians didn't have enough oxygen for treatment, just for a respiratory insufficiency, what happened to the patients? So we couldn't do much for the patients. Unfortunately, the measures that the government did to get these oxygen plants in the jungle was some late. It helped in the second and third wave, but in the first wave, it was not well. It was not well.
I think that that really speaks to the population density and having to look at the numbers per capita. And then for the physicians, you would have to look at the physician numbers and the per capita rates, because I think that while the numbers are way higher, like Angela's saying, in the coastal regions, especially with Lima, compared to the number of doctors and the proportionality of who passed away from COVID, is gonna, I imagine, be higher because the resources were so limited in the more rural areas. Yeah.
So just, I mean, I was briefly looking at some of the numbers that were kind of shown up there. It kind of just off the top of my head, it seemed like the per capita rates of Peru were significantly higher than some of the other countries in Central and South America. So I was wondering if there was particular reasons for that, or like that, I guess, out of proportion per capita rates.
I know. I don't know. I mean, it's like something I've been trying to wrap my head around for like 2 years since the first data came out. And that first year when it came out, I was like, okay, the system in Peru is sophisticated enough to actually be successfully counting the deaths, and everybody else is just behind. But when we get to the actual mortality rates, all cause, it'll even out and it'll make more sense. But I was wrong. That didn't happen. Like Peru, even with like, you know, death rates of all cause combined, it's still just these like peaks that outpace other countries. And so that's kind of what I was talking about earlier. And Angela and I talked about it this morning. It's like, I don't have a really great explanation. You know, I think it's a lot of different factors, right? Like, I'm sure it's very multifactorial. And but like the culture in, I don't know, I've actually never been to any other countries in South America, so maybe I shouldn't, I'm not going to talk about the culture, but I kind of thought it would be a similar culture where everyone is like coming together, but maybe there's something about population density, maybe there, I honestly, I don't know. Angela, what do you think? Do you have any theories on why Peru suffered so?
Personally, I think there are many factors. The first of them is that when around 5 years ago, they did this system, SINADEF is the system in all the country that every doctor who has a patient who died, they have to give a certificate of death, that it's only possible to get it if you enter all the data in the system. So the deaths are very well registered. Otherwise, the family cannot go to the cemetery if they don't have this certificate. So it is very well regulated since 5 years ago, I think. So during the pandemic, it passed the same. And even if we have the COVID test negative, but the doctor suspect that the clinical was COVID, they could inform in the system that it was because of COVID. So I'm sure that the number of deaths are very, very real, what was informed, okay? That didn't happen before 5 years ago. If I want a patient, if I have a patient who died, I could give the paper that he died and sign, and they can go to the cemetery and do it. And the system not necessarily know about it, only when they present the paper. But now every doctor, even we have an usuario, an user, and a password to do it that is personal, and it's only the way to do it. It's one factor. And the second factor is that here in the country, we almost don't have this adult places. I mean, asilos, we said, where all people go to live together. In Arequipa, we only have, I think, two and one small, but because it's very common that they live with the families. So usually in the houses, in the families, there live the grandfathers and the mothers and the sons, and sometimes the families of the sons live together in a house. They try to build up many levels, and they still live together. And also the houses, we don't have big gardens in the houses. Even most of the houses here, they don't have garden. So it is very close one to another. And for culture, it was very, very difficult to keep the distance between the population, between families, between neighbors. It was very difficult. So the government during the pandemic had to be very strict on that. I mean, they said they don't have to go to the market, but the markets were full. So even they have to use the army to go to the streets to try to control, because people couldn't do it, couldn't follow the rules. So I think that was one of the another cause for this mortality. The culture, we are very used to be together, to have meetings on Sundays, family meetings, to have to go to the markets that are very crowded on weekends. I mean, the big stores they follow all the security measures, but the usual markets, they are not. And most of the people goes there. And I remember during the first wave, we have many patients who were the people who were selling the vegetables, the food in the markets. So it was very difficult to control that part. And also the other factor is the immunity. Our level of anemia in our children is very high, but we focus on our children. But to be honest, the program is not focusing on adults or old people to get how to go in the anemia, because we don't have enough resources to do it. So I think also the immunity, it's low. It's low in most of the population. So that could be another reason. We don't have still results of the researches. They are still running, but particularly, I think that those could be the causes.
I think that makes a lot of sense. And I think that, you know, if you're thinking about excess death, if it's every single one is recorded, then, you have to think about the validity of the excess death counts in other countries where maybe there are limits to even the metrics of death, not just attributing it to COVID. And yeah, I mean, I think things like the systems for life, getting a salary, getting food, you know, you can't stop eating. And if you don't have money, you can't, you know, you need money to buy food to live. So I think the practicality of like, you know, what a lot of people, a certain sector of the population in the United States did is just a complete unreality. The supermarket system in Peru is for a minority of people, I would say, right? Yeah.
I forgot the other very important cause is the health system. The health system, we have the percentage less than 4% of the ingress per capita of the budget, no, of the country. So it's very low. It's under the average. So in our city,
Of the health
example,
system, you're saying.
in Arequipa, we have 3 main hospitals that they have more than 70 years ago they were built. And during the last 70 years, we don't have more new hospitals. So you can imagine it didn't advance, the health system didn't improve as much as the population increased. So that was the other problem. We were not ready.
Yeah, and
To
the
be honest.
GDP went to other things. There's no investment in that.
Yeah.
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 One of the main of the 2 main hospitals of the public health, Quiñones is it's like a historic building. It was built, I don't know, like 100 years ago, right? And it's got like the infrastructure is really limited. There's not heating or cooling, so forget about ventilation. I mean, it's just, there's a lot of limitations to the health infrastructure, I would say.
Yeah.
Very
That's
multifactorial though. Yeah.
But the problem is that it's something that goes touch also the political situation that was not good during the pandemic. We changed the president, where the Congress was closed during the pandemic. I mean, it was many factors, but the health system didn't improve, lamentably. Yeah. Unfortunately.
Yep.
But we have hope. We're trying to go ahead.
Thank you. If I can ask maybe just one comment in the question. First, thank you for sharing both your professional and personal stories. I think it really brings to light what global health means for different people in different contexts, and you know, for sharing unfortunate situations that faced during the past few years. My question is, I guess probably a little more for you, but also for you, Angela, around as you start to head back now, opportunities and projects.
I cannot hear very well, and in the microphone, it's not.
Oh, I can summarize what he says. Go ahead, Soho.
You know, you're mentioning the post-pandemic world is going to be different. Like, what are you looking for in terms of projects and work to get that public health sphere in Peru?
Yeah. So Angela, he was just saying, like, in terms of post-pandemic, or, you know, I'm going to put that in air quotes. What are we looking at in terms of like projects and next steps as we move on to the next?
Yeah, after this.
I don't know what to call it. So yeah, go ahead. Go ahead. Yeah.
After the 4th wave, we have a lot of hope because the mortality was so low, and the patients now they're used to all the biosecurity measures. It's not so difficult to explain them, and so we have hope that we're going to improve. and also in the health system, we have new people. We have new people who was hired during the pandemic, and it's very possible that they are going to stay. So we have young doctors, young people, and we're starting to check even in the university. We're starting to do the researches. We're starting to focus in the other programs, like other vaccines for the children, like oncology patients. We are retaking everything, but with more energy than before. So we have hope also that it's going to improve the health system. After this pandemic, also the patients realize the importance to take care of themselves. They are more conscious of what is important. So we think we're going in the good way to improve our health and our patients.
And I
And
would
you,
say,
people like residents who used to come, they're welcome. We need hands to improve.
yeah, and I would say sort of from my perspective, it's like trying to get a sense of where things stand and a little bit of exploring where the attention should go now, how things have shifted and which things remain the same, and trying to get a little bit of a lay of the land, since certain programs all kind of like fell off as related to pediatric medicine, and thinking about what should take first priority as new projects emerge and old projects get like picked up where they left off, basically. So kind of like in my mind, I think the next steps are really like a reevaluation of what needs attention, and kind of going from there. Because a lot of things shifted, and I think it's important also to kind of look now with different lens and see whether certain things have done better, like maybe mental health, if the structure, if one of the core things is like this unity of family structures and community that kept everybody together, there was this negative side that may have contributed to increased COVID deaths, but maybe that fabric of society that continued was protective for mental health reasons, on the other hand. Like I think it's important to really think about everything with like the full spectrum of the effects that it could have had, and consider what needs attention next.
Great.
All right,
Can I
thanks.
ask
Yeah.
you, Dr. Hermosa, to put your emails in the chat if you're willing to share them? So
Yeah,
people
of
can
course.
contact you directly?
And also I placed so thank you again so much, Holly and Angela. Just for everyone in the audience, I placed a link in the chat for a evaluation survey that if you could fill out, that would be great. And we'll take a 10-minute break now, and then we'll start back up at 10:45 here on the West Coast in California with a session from Dr. Hooft around malaria and fever and antibiotic use. So thanks again.
Bye, Angela. Thank you.
Thank you. Thank you very much for the invitation. Thank you.
Thank you.
It was a pleasure.